Hello there, and welcome to another edition of COVID Update for today, May 19, 2021. I am your host, Gomiti Gangden, and as usual, we have with us the Minister of Health, Honorable Dr. Frank Anthony. Dr. Anthony, let's get right to it. Can you give us an update on what the latest numbers for vaccination is?
Well, first of all, thank you for having me on the program. Yesterday, we did a lot of vaccinations, and so overall now for persons who have received their first dose vaccines, we have 172,311 persons. That would be approximately 35.4% of our adult population have now received their first dose of their vaccines. In terms of second dose, meaning that persons who would have come forward and got both doses of their vaccines, we're right now at 38,467. That would be approximately 7.9% of our adult population. And of those who would have received their first dose and now got their second dose, that would account for 22.3%.
Okay. If someone is given the first dose of one type of vaccine, can you clarify whether they can get a second dose of another vaccine?
We are not prescribing vaccines in that way. We're using three types of vaccines. So if you get first dose AstraZeneca, we want you to get back second dose AstraZeneca. If you had the Sinopharm vaccine first dose, you get Sinopharm second dose. And for Sputnik, the Sputnik vaccine itself, it has a component 1 and a component 2. And so if you got component 1 Sputnik, you're going to get the component 2 Sputnik.
Okay. There has been a question on whether, let's say you take the first dose, but you miss your deadline for the second dose, maybe by 2, 3, 5 days. Is that going to affect the efficacy of the vaccine?
Well, our thing is that as soon as you realize that you have missed your date, then make sure that you come as early as possible to get your second dose. If you do that, then it should be fine. However, if you have a prolonged interval, say months after you've missed your date, then that's going to present, I think, some difficulty. The vaccine works best when you have both doses. So if you want to be fully immunized, then you need to come for your second dose. What happens with the first dose? It stimulates your immune system. Your body starts producing antibodies after about the 7th day having received the shot. About 7 days after, your body starts getting a lot of antibodies, and the level of antibodies would be high enough by the 7th day. In some of the vaccines, it goes up to 21 days. And at that point, after about for the Sputnik V and the Sinopharm at 28 days, if you give the second dose, you see the levels of antibodies would keep climbing so that your body would really be prepared to fight off any COVID-19 exposure. If you don't come in that time frame, what normally would happen is that the antibody peaks to a level, not to its optimum, but to a level, and then remain there for a while and then would wean. If you get both doses, it goes higher and stays high for a longer time. So the response is more robust and you'll be more protected. So that's why with all of these 2-dose vaccines, we are encouraging people to make sure once they get their first dose to come back on time and get their second dose. But if you miss the date, please come as soon as possible so that we can give you that second dose.
Okay, great. We've seen some statements emanating from some sections of the society that the Brazilian variant is here in Guyana. Can you confirm this? Have you been able to follow up on this and get an update?
Well, again, I think we dealt with that yesterday because we've seen that somebody from PAHO has said that there is that P1 variant. I have since asked PAHO for a clarification. How did they arrive at this conclusion? And we're still awaiting their response.
Okay. We have seen over the weekend, Prime Minister of Trinidad and Tobago has issued an order for emergency measures in that island because of the rising cases and deaths. Has there been any communication from Trinidad to Guyana through the Ministry of Health or higher levels for any assistance to be given to them from our end?
I know there have been discussions between Trinidad and Guyana. Specific discussions between the Ministry of Health, Guyana, and Trinidad. We have not had those specific discussions. But in whatever way that we can assist, we are open to help in whatever way we can. We know that Trinidad is going through a very difficult time at this moment because they've had a surge in cases. They have quite a lot of active cases, and unfortunately, once you have a lot of active cases, you are going to get hospitalization. So it is quite a challenging time for Trinidad, and whatever help we can give, we'll certainly, make ourselves available to give that type of help.
But at this time, there is no formal request.
No.
Okay. Lastly, today we're celebrating World Family Doctor Day, and we're observing this day in a raging pandemic. How do you think these members of the medical fraternity contributes to this fight, especially at a community level?
Well, World Family Doctor Day is a day dedicated to reflect and honor those who work in family medicine. Family medicine, traditionally we have had doctors who practice at the primary care level, but family medicine has evolved since, and it's more of a speciality and acts as a bridge between primary health care and more sophisticated healthcare services. Family doctors have in the past and continues to be that bridge, and also help to track patients over their life cycle, because they would be acquainted with these patients from a younger age until they become adult and so forth. So that allows the family doctor to really understand more in depth the person's medical history and so forth, and to be able to work with them throughout their lifetime. And so it's an important service that they offer. More recently in Guyana, we have started to develop this specialty. We have set up a course in family medicine, and many doctors have now graduated from that course, and it's something where doctors who've been generally trained can take on a career as a family physician. And so we have been training people in this direction because we recognize the importance and the need for these types of doctors. So I think while we're doing that globally also, family care physicians, the importance of them have been recognized globally. And so this date has been set aside as a way of reflecting on what family care physician does and what they continue to do. And I would like to extend my congratulations and thank you to all those family health care physicians and primary health care physicians as a whole who have been working in this field and who have made such a tremendous difference in improving the quality of health care and the quality of patients' lives across Guyana.
Now, Dr. Anthony, quickly before we wrap up, I know your vaccination centers across the country, they operate Monday to Friday, sometime between 8 and 4. Do you think that government would consider extending those timings and even onto the weekends for especially those persons who get off at 4 or can't get time off to go and take their vaccinations during the week?
Well, first of all, we have, since we have started the vaccination process, We have had two types of centers. We have had those that are at fixed sites that people can come and they'll always be working. And we have had mobile sites where we try to go closer to the community to get give people better access in those communities. So we have been doing that. We have also been extending the hours, and we do work on weekends. So it's not that we go Monday to Friday. We also do weekends, and we do outreaches and so on the weekends. Now, one of the things that I really want to encourage people to do is really to take advantage of the services that we are offering, because in many of the centers that we have, for the whole day, sometimes nurses, the health personnel are there, and nobody is coming. And so that is not, that's not a job satisfying, because you're waiting the whole day and nobody shows up. So we hope that we can encourage the population to take advantage of this, because we really want to immunize as much people as possible. We have those vaccines available, and if we can get more people to come out to the sites, that would certainly help us to take up those numbers. We are considering, and as of this weekend, we will be implementing extended hours of work here in Georgetown. So we want to go to about 8 p.m. in the night, and let's see, we'll start that as an experiment to see whether or not we'll get more people coming out. But we don't want people wait the whole day. The place is vacant the whole day, nobody is coming out, and then you wait till the evenings and then you have a crowd. If these centers are working from 8 in the morning, we want people to start coming out from 8 in the morning. If you come early and once there isn't a crowd, it doesn't take a long time to get the vaccination. So just come, let's do this. Even if you have to take some time off, I think it's important that you take that time off and come and get your vaccines, because in the long run, this is going to be better for you. It's going to be better for the work environment as well, because if everybody in the work environment is vaccinated, then that offers a protective effect in that particular workspace. So I really want to urge people to make this a priority. Even if you haven't had a vaccine as yet, make sure you come out and get the first dose. If you got the first dose, check your vaccination card. Ensure that you understand when you're due for your second dose, and come and get your second dose. In some cases, because people would have gotten their first dose when we did one of those mobile clinics, if your second dose is due and you're not sure whether another mobile clinic would happen in that time frame, then make sure you go to one of the fixed sites so that you can get that vaccine. Right? So it's very important that we do that, and so we can get the numbers going and we can get closer to herd immunity. In some of the regions, they're doing better than others. And that's another thing that we have to look at, because let's say in Region 6, they're now at one of the leading regions in terms of first dose vaccination. They're at 42%, while in Region 10, we're still at 10.7%. So there's a lot more work to be done in Region 10. We know that there are lots of myths that are circulating in Region 10, and hopefully as we engage more of the leadership in Region 10, that people would come forward and take their vaccines. This thing is real. As we speak today, there are more than 147 active cases in Region 10, and we have had one person from Region 10 that died recently. So this is not, it's a very important thing for people to understand, because we know these vaccines work. If you take your vaccines, it would reduce spreading the infection, reduce hospitalization, and of course, it would prevent deaths. So let's encourage each other, encourage friends, family, persons that you know, just go out and get the vaccine.
Thank you. Thank you so much, Dr. Anthony. That has been the COVID update for today, May 19th, 2021. Thank you for joining us. Do have a blessed rest of the day. Goodbye.